Hello everybody. Welcome to our YouTube channel, Equation by Pharmacist Moms. We are here with an interesting topic for you, and that is interpretation of pharmacy prescriptions and medication orders. Luckily, many prescriptions are no longer handwritten but computer-generated and are transmitted electronically to the pharmacy. However, some prescriptions are handwritten, and being a pharmacist, you have to manage to read the doctor's handwritten prescription. This video will help you to understand the prescriptions by explaining how to translate the Latin abbreviations used by healthcare providers on prescriptions so that you can protect yourself from prescribing errors. Let's start off. How would you decode naproxen 250 mg PO BID x 5 days? To start, the first part of a prescription is the name of the drug. It can be a brand name or generic. The next part, 250 mg, denotes the strength of the drug. In this case, it's 250 mg. PO means the medication is taken by mouth. BID, or twice a day. The X indicates this prescription is taken for a period of 5 days. So, it can be interpreted as, give 250 mg of naproxen orally, 2 times a day, for 5 days. Now, try to interpret these examples. You can also refer to the video on pharmacy abbreviations, which we have already uploaded on our channel. First, interpret these subscriptions, which are directions to the pharmacist, taken from prescriptions. Subscription 1. Cefaclor, 500 mg, PO, stat, then 250 mg, Q 8 hours. It can be interpreted as, give 500 mg of cefaclor orally immediately, then 250 mg every 8 hours. Subscription 2. FT. Sup. Number 12. It can be interpreted as, make 12 suppositories. Subscription 3. Disp. Sup. Rect. Number 12. It can be interpreted as, dispense 12 rectal suppositories. Subscription 4. FT. ISO. Sol. Disp. 120 ml. It can be interpreted as, mix and make an isotonic solution. Dispense 120 ml. Subscription 5. Et. DIV. In pulv. Number. XL. It can be interpreted as, mix and divide into 40 powders. Subscription 6. DTD 6. Non-rep. It can be interpreted as, dispense 6 such doses. Do not repeat. Subscription 7. Disp. 12 ml, and QS, add, to 15 ml. It can be interpreted as, dispense 12 ml, and add a sufficient quantity, to make 15 ml. Subscription 8. Et. FT. Cyst. 1 gram per TB/SP. Disp. 60 ml. It can be interpreted as, mix and make a suspension, containing 1 gram per tablespoon. Dispense 60 ml. Subscription 9. Et. FT. Pulv. DTD-C. It can be interpreted as, mix and make powder. Divide into 100 such doses. Subscription 10. FT. It can be interpreted as, mix and make an ointment. Subscription 11. Et. FT. Disp. 10 grams. It can be interpreted as mix and make ointment. Dispense 10 grams. Subscription 12. M. Et. Ft. Caps. DTD 48. It can be interpreted as mix and make capsules. Dispense 48 such doses. Subscription 13. Ft. Cap. Number 1. DTD number 36. N. R. It can be interpreted as make 1 capsule. Dispense 36 such doses. Do not repeat. Subscription 14. M. Et. Ft. I. V. Inch. It can be interpreted as mix and make an intravenous injection. Subscription 15. Label hydrocortisone 20 mg tabs. It can be interpreted as label hydrocortisone 20 mg tablets. Subscription 16. Give SS TBSP CISP Stat. It can be interpreted as give 1/2 tablespoon of suspension immediately. Now, try to interpret these signas, which are directions to the patients, taken from prescriptions. Signa 1. Sig, 1 tab, PO, QID, PC, and HS. It can be interpreted as take 1 tablet by mouth, 4 times a day, after meals and at bedtime. Signa 2. ITAB, PO, QID, PC. It can be interpreted as take 1 tablet by mouth, 4 times a day, after meals. Signa 3. ITAB, SL, PRN, chest pain. It can be interpreted as place 1 tablet under the tongue as needed for chest pain. Signa 4. Tab. I sublingually, rep. P. R. N. It can be interpreted as place 1 tablet under the tongue, repeat if needed. Signa 5. Tab. PO, QOD. It can be interpreted as take 1 tablet by mouth every other day. Signa 6. 2 stat, then ITAB, PO, QID, X, 10D. It can be interpreted as take 2 tablets immediately, then 1 tablet by mouth, 4 times a day, for 10 days. Signa 7. 2 stat tab. 1 Q. 6 hours. 7D. It can be interpreted as take 2 tablets immediately, then take 1 tablet every 6 hours, for 7 days. Signa 8. 1 tab, PR, QD, PRN. It can be interpreted as insert 1 tablet rectally, each day, as needed. Signa 9. 3 tab, PO, TID, X, 7D. It can be interpreted as take 3 tablets orally, 3 times daily, for 7 days. Signa 10. Take 1 to 2 tabs, P, O, Q 4 hours, PRN, pain. It can be interpreted as take 1 to 2 tablets, by mouth, every 4 hours, as needed for pain. Signa 11. Take 1 tab, PO, QOD, swelling, PRN, LE. It can be interpreted as take 1 tablet, by mouth, every other day, as needed for lower extremity swelling. Signa 12. Tab I, PRN, SOB. It can be interpreted as take 1 tablet, as needed for shortness of breath. Signa 13. Tab I, QAM, HBP. It can be interpreted as, take 1 tablet every morning for high blood pressure. Cigna 14. Dab 2, Q 6 hours, ATC, UTI. It can be interpreted as, take 2 tablets every 6 hours, around the clock, for urinary tract infection. Cigna 15. Add crushed tablet to pet's food S.I.D. It can be interpreted as, add crushed tablet to pet's food once a day. Cigna 16. Caps. I, Q, I, D, P, C, et, H, S. It can be interpreted as, take 1 capsule 4 times a day, after each meal and at bedtime. Cigna 17. ICAP, PO, TID, a C, plus HS. It can be interpreted as, take 1 capsule by mouth 3 times daily, before meals and at bedtime. Cigna 18. 1 cap, PO, TID. It can be interpreted as, take 1 capsule by mouth 3 times a day. Cigna 19. Take 1 cap, PO, PC. It can be interpreted as, take 1 capsule by mouth after meals. Cigna 20. Caps I, C overscore, AC, H, S, N, R. It can be interpreted as, take 1 capsule with water at bedtime. Do not repeat. Cigna 21. Cap. 2 1 hour. Prior to departure, then cap. I after 12 hours. It can be interpreted as, take 2 capsules 1 hour prior to departure, then 1 capsule after 12 hours. Cigna 22. Humulin N, NPH, U100 insulin, 30 units, subcute, daily, 30 minutes of breakfast. It can be interpreted as, take 30 units of Humulin N, NPH, U100 insulin, subcutaneously, every day 30 minutes, before breakfast. Cigna 23. IGTT, OU, BID, X, 7D. It can be interpreted as, instill drop in both eyes twice a day, for 7 days. Cigna 24. GTT. 2, HIQ. 4 hours. P, R, N, pain. It can be interpreted as, instill 2 drops in each eye every 4 hours, as needed for pain. Cigna 25. GTT. 2, RT. I, every AM. It can be interpreted as, instill 2 drops in the right eye every morning. Cigna 26. 2, GTTS, OU, QI, UD. It can be interpreted as, apply 2 drops to each eye 4 times daily, as directed. Cigna 27. Instill 1, GTT, A, S, Q 2 hours, ATC, WA, UD. It can be interpreted as, instill 1 drop in the left eye every after 2 hours, around the clock, while awake, as directed. Cigna 28. Instill GTT. 2, HI of neonate. It can be interpreted as, instill 2 drops into each eye of the newborn. Cigna 29. 4, GTTS, add, Q4 hours, X, 5D. It can be interpreted as, instill 4 drops into right ear every 4 hours for 5 days. Cigna 30. GTT. 4, right ear, M, and N. It can be interpreted as, instill 4 drops into the right ear, morning and night. Cigna 31. GTT. V each ear 3D. S, O, S. It can be interpreted as, instill 5 drops into each ear 3 times a day, as needed. Signa 32. Apple. Left eye, ad lib. It can be interpreted as, apply ointment to the left eye as needed. Signa 33.
Half inch chung, OU, BID, X7D.
It can be interpreted as, apply half-inch ointment to both eyes twice a day for 7 days. Signa 34.
Apply CRM, top to AA, QID, PRN, itchiness.
It can be interpreted as, apply cream topically to the affected area 4 times a day, as needed for itchiness. Signa 35. Apple. AM and PM for pain, PRN. It can be interpreted as, apply morning and night as needed for pain. Signa 36. IAPPLE, VAG, QHS. It can be interpreted as, insert 1 applicatorful, vaginally, every night, at bedtime. Signa 37. ISUP, PR, Q4HPRN, nausea. It can be interpreted as, insert 1 suppository rectally, every 4 hours, as needed for nausea. Signa 38.
Use 1 sup, PR, QD, PRN, constipation.
It can be interpreted as, use 1 suppository rectally, every day, as needed for constipation. Signa 39.
Inhale 2 puffs, via MDI, BID, QM, and HS.
It can be interpreted as, inhale 2 puffs, via metered dose inhaler, twice a day, every morning, and at bedtime. Signa 40.
Inject 10U, SQC.
It can be interpreted as, inject 10 units subcutaneously before meals. Signa 41.
ISS, TSP, PO, TID, PRN, cough.
It can be interpreted as, take 1½ teaspoonful, by mouth, 3 times a day, as needed for cough. Signa 42. TBSP. I in 1/3 of a gallon AC. Q. 6 hours. It can be interpreted as, take 1 tablespoonful, in 1/3 glass of water, every 6 hours. Signa 43. TSP. IX, AC. Q. 4 or 5 hours.
PRN, pain.
It can be interpreted as, take 1 teaspoonful in water, every 4 or 5 hours, as needed for pain. Signa 44. Dill. C/score, volume AC. And use as gargle Q. 5 hours. It can be interpreted as, dilute with an equal volume of water, and use as gargle, every 5 hours. Signa 45.
Apothecary symbol for ounce 2, for XD, P, C, and H.
S. It can be interpreted as, take 2 teaspoonfuls, 4 times a day, after meals and at bedtime. Signa 46.
Apothecary symbol for ounce SS, A, C, T, I, D. It can be interpreted as, take 1 tablespoonful, before meals, 3 times a day.
Signa 47.
Take Bactrim DS tab, PO, BID, C/score, plenty of fluids.
It can be interpreted as, take Bactrim double strength tablet, by mouth, twice a day, with plenty of fluids. Signa 48.
Penicillin 250 mg, PO, QID, times 10 days.
It can be interpreted as, take 250 mg of penicillin by mouth, 4 times a day, for 10 days. Signa 49. Nitroglycerin 0.4 mg, SLQ 5 minutes times 3 doses, PRN. It can be interpreted as, take 0.4 mg of nitroglycerin, sublingually, every 5 minutes, in 3 doses as needed. Cigna 50.
Chlorothiazide 0.25 grams, ITAB, PO, QMPRN, swelling.
It can be interpreted as, take 1 tablet of 0.25 mg chlorothiazide, by mouth, every morning, as needed for swelling. Cigna 51. Synthroid 0.025 mg, PO, daily at 8 a.m. It can be interpreted as, take 0.025 mg of Synthroid orally daily at 8 a.m. Cigna 52.
Phenergan 25 mg, PO, Q4 to 6 hours PRN.
It can be interpreted as, take 25 mg of Phenergan orally, every 4 to 6 hours, as needed. Cigna 53. Benadryl Elix.
Apothecary symbol for ounce, SSTBSP, PO, Q4 hours, PRN, itching.
It can be interpreted as, take Benadryl elixir, 1 tablespoonful, orally, every 4 hours, as needed for itching. Cigna 54. Meperidine 50 mg, and promethazine 25 mg, IM, Q4, 6 hours, PRN pain. It can be interpreted as, take 50 mg of meperidine, and 25 mg of promethazine, intramuscularly, every 4 to 6 hours, as needed for pain. Cigna 55. Zithromax 250 mg tab, 2 PO stat, then tab IPO daily, on days 2 to 5. It can be interpreted as, take 2 tablets of Zithromax 250 mg, orally, immediately, then 1 tablet orally, daily, next day, till day 5. Cigna 56.
Linoxin 0.25 mg tab, PO, QM, if P60, or upward arrow.
It can be interpreted as, take Linoxin 0.25 mg tablet, orally, every morning, if pulse is 60, or higher than, 60 beats per minute. Cigna 57. Digoxin 250 micrograms tab, IQM, when P upward arrow 60. It can be interpreted as, take 1 digoxin 250 micrograms tablet, every morning, when pulse is higher than 60 beats per minute. Cigna 58. Dexamethasone 1.25 mg, 2 tab, QID times 2, ITAB QID times 2, ITAB TID times 2, tab daily times 5. It can be interpreted as, take 2 tablets of dexamethasone 1.25 mg, 4 times a day, for 2 days, then take 1 tablet, 4 times a day, for 2 days, then take 1 tablet, 3 times a day, for 2 days, then take 1 tablet daily, for 5 days. Cigna 59. Benstropine half a milligram, ITAB TID times 15D. It can be interpreted as, take 1 tablet of benstropine, 0.5 mg, 3 times a day, for 15 days. Cigna 60. Guaifenesin extended release 600 mg tabs, IQAM, and bedtime. It can be interpreted as, take 1 guaifenesin extended release, 600 mg tablet, every morning, and at bedtime. Lastly, interpret these directions taken from medication orders. Direction 1. Give 5 ml NGTQD. It can be interpreted as, give 5 ml via nasogastric tube, every day. Direction 2. Give 50 micrograms, IVPQ 5 minutes, PRN, agitation. It can be interpreted as, give 50 micrograms, by intravenous push, every 5 minutes, as needed for agitation. Direction 3.
Ambien 10 mg, P, O, QHS, 5D.
It can be interpreted as Ambien 10 mg by mouth at every bedtime for 5 days. Direction 4. FT, IVPB of potassium chloride, 20 mEq in 250 ml NS. It can be interpreted as make an intravenous piggyback of potassium chloride, 20 milliequivalents, in 250 ml normal saline. Direction 5. 1000 ml D5WQ. 8 hours. IVC overscore 20 mEq kcl to every third bottle. It can be interpreted as 1000 ml of 5% dextrose in water every 8 hours, intravenously, with 20 milliequivalents of potassium chloride added to every third bottle. Direction 6. Admin.
Prochlorperazine 10 mg, IM, Q, 3 hours. PRN, N and V.
It can be interpreted as administer 10 mg of prochlorperazine intramuscularly every 3 hours, if there is need, for nausea and vomiting. Direction 7. Minocycline HCl CISP.
1 TSP, P, O, Q, I, D, DC, after 5D.
It can be interpreted as 1 teaspoonful of minocycline hydrochloride suspension, by mouth, 4 times a day. Discontinue after 5 days. Direction 8.
Propranolol HCl 10 mg, P, O, T, I, D, A, C, and H.
S. It can be interpreted as 10 mg of propranolol hydrochloride, by mouth, 3 times a day, before meals and at bedtime. Direction 9. NPHE 100 insulin, 40 units, sup every day, AM. It can be interpreted as 40 units of NPH, 100 unit insulin, subcutaneously, every day in the morning. Direction 10.
Cefamandrol nafate, 250 mg, IM, Q, 12 hours.
It can be interpreted as 250 mg of cefamandrol nafate intramuscularly, every 12 hours. Direction 11.
Potassium chloride, 15 mEq, P, O, B, I, D, P, C.
It can be interpreted as 15 milliequivalents of potassium chloride, by mouth, twice a day, after meals. Direction 12. Vincristine sulfate, 1 mg/m 2 pints BSA. It can be interpreted as 1 mg of vincristine sulfate per square meter of patient's body surface area. Direction 13.
Flurazepam 30 mg, at HS, PRN, sleep.
It can be interpreted as administer 30 mg of flurazepam at bedtime as needed for sleep. Direction 14. D5W, 20 mEq, kcl/L, at 84 ml/hour. It can be interpreted as administer 20 milliequivalents of potassium chloride per liter in D5W, that is 5% dextrose in water, at the rate of 84 ml per hour. Direction 15. 2.5 grams/kg/day amino acids TPN. It can be interpreted as administer 2.5 grams per kilogram of body weight per day of amino acids in total parenteral nutrition. Direction 16. Procrit, Epidin alpha stat. 150 units/kg sub-Q. 3 weeks 3 to 4 weeks. It can be interpreted as start Epidin alpha Procrit immediately at 150 units per kilogram of body weight subcutaneously and then 3 times a week, for 3 to 4 weeks. Thank you.